Well, Dr. Thompson, welcome to the Aging Well podcast. For our listeners who may be hearing the term for the first time, what exactly is tinnitus or tinnitus, and how common is it?
Tinnitus, also pronounced tinnitus, is a ringing or hissing sound that about 10% of Americans have a significant amount of. It is a strategy from the brain to create this phantom sound because some of the cells in the hearing system are not passing the signal through. So just like phantom limb, someone loses their arm, but they still feel like they have a hand, the brain is making up these neurological sensations, and they feel pain in their hand. Well, similarly for tinnitus, what's very common is that someone has a mild high-pitched hearing loss, and their brain creates a high-pitched hissing sound. So that's what it is.
Hey guys, it's Dr. Ben. Quick word. We just launched 2 physical locations, 2 new tinnitus clinics with Treble Health. And it's all because of you, people like you who watched our videos and spread the word that there is help for tinnitus. I'm so excited to announce that right now, starting July 1st, you can see in-person audiologists from Treble Health. We're launching with San Francisco, California, and South Florida in location Weston, which is west of Fort Lauderdale. So if you live in the greater Northern California area, or if you live in Florida, I would highly encourage you to look at our website, treblehealth.com, and go under the locations. You can see the 2 clinics and what we offer. If you're someone who needs help for tinnitus, you're watching this because you need advice, you're looking for a solution, you need to identify what is the cause of this tinnitus, what can I do about it? Absolutely, we are here to help. If you or anyone you know could benefit from this, connect my team with them and come visit us in San Francisco or South Florida. I'll include the links below for you to go on our webpage and learn more about our doctors and our locations. Thank you so much. Now back to the video.
Interesting. Now, it's not the same as, like on occasion, I may hear just like a high pitch, sound in my ears. That's just probably picking up some frequencies around. It's not necessarily the same thing.
Very good question. It is the same phenomenon. However, that would be considered a transient 10 to 30 second ringing. That usually happens in just one ear. That is even more common. I would say that happens to over 50% of the population. We're not too worried about that. There are some theories around how when that happens, it might be certain neuron cells in the auditory system that are sort of screaming on their way out. We don't know exactly why that happens, but it is common, and it does not mean you should go to your doctor if you experience that.
Yeah, hearing is probably one of the most fascinating aspects of human physiology and anatomy that I've studied. Just how we're able to take these waveforms and just convert them into something that we understand and know. And when there's so many different frequencies traveling simultaneously. So what are the most common causes or risk factors for developing tinnitus, particularly as people age?
Tinnitus is something that can occur at any age, and most commonly it occurs between the ages of 40 and 60, and it can be the first sign of changes in our hearing system. So we typically know with vision, right, that even for someone who has 20/20 vision, once they get to a certain age, it is normal to lose some of the clarity of their vision. And for hearing loss, similarly, the normal healthy aging process, even if someone is very healthy, they are expected to slowly lose their hearing amongst other senses, right? So the tinnitus sound, the ringing or the hissing, it can be the first symptom that there are some changes going on to the hearing. And that would be the most common cause of tinnitus, hearing loss. Other causes that can play a role are, number 2, is called stress-induced tinnitus. This is actually related to the central nervous system. So if someone's going through a lot of psychological stress, financial stress, they're moving, they're going through a challenge in their relationship, their brain can be on more high alert, and it can look for signals or stimulus that it deems important or a threat. And that hissing or ringing sound can be interpreted as a threat or a danger, and it can actually be made louder. So stress and tinnitus are very much linked. That can cause tinnitus, and it can be a big part of how we manage it. And then the final piece that I'll introduce would be somatic or somatosensory tinnitus. this is related to the jaw or the neck. And you'll hear me say tinnitus or tinnitus. For the rest of this podcast, I'll say tinnitus, but both are totally okay. So sometimes issues in the jaw or the neck can actually send signals through the trigeminal nerve, one of the cranial nerves, and that can create a sound in the brain as well.
This is all fascinating. And yeah, I'm going to struggle probably with what do I say now that I kind of understand that there's two pronunciations of it.
Jeff, let's go with tinnitus.
Tinnitus. So, all right. So how, you've kind of alluded to this a little bit, but how is tinnitus different from or connected to hearing loss?
Yeah, how it's connected is that the very sounds that your hearing cannot send or hear through the system, those are often the sounds or the pitch of tinnitus. So if someone has a high-pitched hearing loss, they will likely experience some high-pitched tinnitus when they're in a quiet enough room.
So is it more of a hearing issue or a brain issue that's causing tinnitus?
Great question. It can be both. And often the hearing system is the trigger of why this all starts. But the tinnitus sound or the ringing, the hissing, that's actually in the auditory brain. If we were to, find the neurons in the brain that are responsible for it and say, shut them off, then an individual would not hear tinnitus.
And so you mentioned stress and I assume anxiety goes along with that they can interact with the tinnitus symptoms. First of all, is it more of a transient kind of tinnitus if it is linked to stress, or is it just that the tinnitus is aggravated more by the stress? And how can chronic stress actually make this all worse?
Yeah, great question. So if someone experiences, significant tinnitus, they get a hearing test and the hearing test shows, hey, Jeff, you don't have hearing loss. Actually, your hearing is pretty normal. Then that would put someone like myself, when I see patients, right? A lot of people come to me and my team for tinnitus problems. So we want to look at all the data we can get. One of those pieces would be the hearing test. And if that shows there's no hearing loss, then we start to investigate, perhaps this is coming from a stress-based response. Perhaps this is coming from a neck or a jaw issue. And that's where we do some case history, differential diagnosis, and then provide a plan for the patient. If someone has a stress-induced tinnitus, then there is nothing broken or permanently wrong in the system. So their symptoms can return to normal or near normal after a proper treatment.
And I would assume that this can have a lot of implications for just health in general. But how does it impact one's sleep, their ability to focus, mental clarity, all those types of things?
That's a great question. Tinnitus as well as hearing loss, these are both invisible conditions, right? So if you know someone in your family, they might tell you, hey, I have some hearing loss, or I'm dealing with this bothersome tinnitus. But if you meet a stranger or someone you work with, they're probably not going to really express it or share that much about it, but it has a big impact on their life. Tinnitus can create anxiety. It can create a stress response, insomnia, sleep difficulties. For our patients who work with us, it really can turn their life upside down. Jeff, I've had a patient who told me she went through a serious form of cancer and her tinnitus was way harder to deal with than the cancer.
Wow.
So it is a problem. Not that many people talk about it. It's also a very niche subject where most doctors just know a little bit about it. To get good results with treatment, a lot of knowledge and experience and the right plan is important.
That's why I'm excited to have you on this podcast, because part of aging well is dealing with these issues that we might not talk about as much. And seen a lot with tinnitus and hearing loss and the role that they can play in overall cognitive decline and dementia and so on. So what does the research say about the link between hearing loss, tinnitus, and cognitive decline or dementia?
I'm really glad that you brought this up. So one of the points I wanted to mention was that hearing loss has been identified as one of the most significant modifiable risk factors for dementia. And if there's one thing that the Aging Well podcast can focus on, in my opinion, it's cognitive function. I speak with a lot of patients who are in the 50 to 70-year-old range. And the one thing that motivates them more than anything else is keeping their brain healthy. And I want to touch on the data I have, but I'm actually curious to get your thoughts on this particular subject, like cognition. How common of a theme is that here on your podcast? And I'd love to hear your thoughts on the importance of it.
I think it's one of our most important and probably most addressed topics on the podcast. And we initially got into this podcast. I'm an exercise physiologist. And so, the exercise piece was a big part of it starting out. And I teach a pathophysiology and exercise class, and probably listeners and viewers are probably sick of hearing the same story. But over the first years of teaching that course, I very quickly recognized that if we want to minimize the risk of sickness and illness, disease, and have better longevity, it was exercise, eat a healthy diet, maintain a healthy body composition, and don't smoke. And over the course of the last year, talking to more and more experts and physicians and people, really dealing with brain health and longevity, I came to realize that sleep was a very critical factor in that and how that impacted brain health. And then from there, we also kind of added into our pillars the idea of purposeful social connections and how those all work together to affect the brain. And I think over the last probably season and a half, maybe 2 seasons, brain health has become a very significant component of the Aging Well podcast. Because again, if we can't function cognitively, it doesn't matter how much muscle you have, what your cardiovascular health is, your life is going to go downhill. And so brain health is probably one of the most important aspects of aging well. And
it begs the question, well, what is controllable with dementia? Because what research has found is there's some genetic components. However, there's also some lifestyle components. And that term I'm going to discuss here is modifiable risk factor. So smoking is a good example where you don't have to smoke. That's a risk factor for lung disease, for cancer, et cetera, heart disease. And for dementia, researchers have studied, well, what can people actually do to prevent it? And there's some interesting data that came out. So there was a 2020 Lancet commission that reported that addressing hearing loss could prevent up to 9% of dementia cases globally, surpassing other factors like hypertension and smoking. If you look at the list of the modifiable risk factors for dementia, hearing loss is one of the top ones, and specifically treating the hearing loss. So for people, that means getting a hearing test. And if you're recommended to try hearing treatment, which most commonly are hearing aids for your communication, then you should do it. And what you shared earlier, the social component, that's the biggest thread that runs through this research, that when people are more connected to their family and friends, when they have a more robust social life, when they're engaging in communication, that's good for our cognition, also our mental health, also our stress. So it all, that's one thing that's in our control. Now, Jeff, how could you communicate well and be engaged with your social environment if you can't actually hear them, if you're missing words? Sometimes patients with hearing loss, they say, I don't like going out to the restaurant because I can't hear anyone. It's stressful. I don't really like going out. I'm just going to stay at home. And you can see how those kinds of maladaptive behaviors end up creating a situation where someone with untreated hearing loss has a higher risk for cognitive issues.
Yeah, I was thinking about that as you were going through all that if we want to be socially engaged, but we can't hear people, we tend to withdraw a lot more. And people who have hearing loss are not going to be as engaged with their communities as they could be.
And also I'll add that it's not simply hearing, because I think a lot of people would say, oh, I hear okay. It's just sometimes it's hard to hear. There's a lot of listening effort that goes into that. And it takes some of our cognitive resources when it's so hard to understand what people are saying, like a situation of a restaurant or, your grandson's birthday party where a lot of people talking, lots of background noise, you're putting in a lot of listening effort. So that also plays a part here.
Yeah, and that's hard enough in public with good hearing. When there's so much noise going on and so much, resonating sounds, it's hard to kind of comprehend. And I can't imagine having to try and sort through when you're trying to really focus in on what one person's saying and you're not getting all the noises in your head.
Jeff, have you ever experienced, hearing loss or tinnitus? Have you ever gotten a hearing test? Curious about your ears.
I'm trying to think the last time I had a hearing test. I haven't had any real issues with hearing. If anything, my issues with hearing would be that I tend to not get rid of the extraneous sounds. I don't know if I truly have misophonia or any of that kind of stuff, but I do get more, I don't know what the word agitated is the right word to say, but, I'm more bothered by a lot of extraneous sounds. And so I think I hear too well sometimes, and that can be just as much of an issue.
Interesting. Well, for anyone listening who is curious of how well do I hear, I would recommend getting a hearing test. Typically every 1 or 2 years, we would recommend patients who are 50 years or older to get a hearing test. Just like an eye exam is good to measure these things and have a baseline. Even if you're not having problems now, it's good to have that baseline moving forward. And our practice at Treble Health historically, Jeff, has been telehealth. Similar to you, started a YouTube channel, podcast, and was able to reach a lot of patients, and we have a telehealth offering. But in the second half of 2025 and beyond, we're actually opening physical brick and mortar clinics for tinnitus and for hearing treatment in Northern California, South Florida, and more to come. So yeah, I would just encourage folks to measure their hearing and take control of their health in that regard.
And we'll have links to connect all that, in the description of the podcast. But so you can actually identify hearing loss issues and all that remotely?
Yeah, the hearing test component would happen in person.
Okay.
Some of the treatment can happen remotely, whether for tinnitus or hearing.
And so you've kind of addressed this a little bit already, but why is it so important to treat tinnitus or hearing loss early rather than just living with it?
For tinnitus, what I typically recommend, if someone has it and it's really bad or it's bothering them, then give it a little bit of time to see if it gets better on its own. Use some self-help tools like certain kinds of sound therapy or some basic cognitive behavioral strategies. Get your sleep in the best order that you can. Try to not be so affected by anxiety or stress response from the tinnitus sound, and put things in order. However, if that's not really working and you're still struggling, that would be the right time to go to a professional. I've seen it really change people's lives in the sense that they come to me very anxious, stressed, they're not sleeping well, they're noticing their energy is lower, their relationships at home with their spouse or their family are not what they used to be. This invisible sound is really taking a toll on them. So the quality of life benefits are very clear. If you can get those things in a much better place, that makes people happier. It makes people more connected. So try to do that and take that seriously. I do have another mention. There was something called the Achieve study that looked at how hearing loss can significantly slow cognitive decline. So that Achieve study revealed that among older adults at an increased risk for cognitive decline, those who received hearing aids with an audiologist like myself, those individuals experienced a 48% reduction in the rate of cognitive decline over 3 years compared to those who did not receive hearing aids. So it's painting a clear picture here of, okay, first you have to identify, do you have this condition, hearing loss? And then if so, there's research to support getting it treated properly is very beneficial for your brain, so that as you're keeping your body healthy over the years, your mind can stay with it. We don't want a situation where the body's still going, but the mind has faded. And that's really, a sad reality that many of us have family or friends of friends who experience cognitive decline.
So you mentioned a few things that people can begin to do themselves to kind of treat if they're kind of seeing the early signs of tinnitus. But what are the most effective evidence-based treatments available today for tinnitus that you use in your practice?
Great question. So there's 3 that I can talk about. One is called tinnitus retraining therapy. The second is called cognitive behavioral therapy. And the third is called bimodal stimulation. Tinnitus retraining therapy includes devices that are worn on the ears. I have some with me right here. So most commonly, these are hearing devices that when they're fit on, for those of us who are on video, I'll show you guys, when these devices are on the ears, they look similar to modern hearing aids, sleek with a piece up and behind the ear. And for tinnitus retraining therapy, someone would have those fit for what's called sound therapy. So imagine a soothing white noise that mixes in with the tinnitus sound. and an individual would wear those on their ears during daytime hours for a treatment period of most commonly between 6 and 12 months. Additionally, an audiologist like myself trained in this method would provide specific types of counseling and coaching on how to deal with sleep, how to deal with stress, anxiety related to the sound. So separately, there's an approach called cognitive behavioral therapy. And this is a more psychological approach where we know that the tinnitus can impact the limbic system, which is our emotional regulation, our fight or flight response. And if we can get that in a better place, then the brain can start to learn over time to reduce the sound. All of these conditions, all these treatments I'm talking about, the goal is to reduce the awareness and ideally the volume of the tinnitus sound over time. So that can change people's lives, and that's what they're all aiming to do. The third approach is bimodal stimulation. And currently there's a device that uses two forms of stimulation, one through the tongue and one through the headphones. And that particular device also aims to reduce the tinnitus sound over time. Based on the individual case and what someone is going through, along with the existing evidence that's available today, a tinnitus specialist like myself, an audiologist most commonly, potentially an ENT, ear, nose, and throat doctor, we would work with that patient and recommend a specific treatment that we think has a high likelihood of success.
In addition to cognitive decline, what other major health risks are associated with hearing loss and tinnitus?
With tinnitus, health risks are the quality of life, insomnia, anxiety. With hearing loss, awareness of your environment and safety, plus the brain health and communication.
So I would think there'd be some association with metabolic conditions because,
Tell me more about
if
that.
we're not getting enough sleep and all that kind of stuff, our hormones get out of balance.
Absolutely. And I'd be curious of, your thoughts of if someone has tinnitus and they're they're more stressed and they're not sleeping. I mean, though what I've learned over the years from my own personal health, stress and sleep are the foundation of everything else. So what would happen for someone for any reason if they start to get worse sleep and they're stressed all the time?
I mean, again, I don't have the literature backing all of this up, but I would assume that, you would see cortisol certainly be out of balance because we're not getting that regular circadian rhythm with proper sleep. That can impact our weight, our insulin resistance, the risk of diabetes. I could just see that a whole host of conditions that we generally associate with high stress, with physical inactivity and all those types of things could also be associated with tinnitus.
Absolutely. Absolutely. I would definitely agree from a doctor in this field who's personally worked with hundreds of patients, and we have a team of 8 audiologists working exclusively with tinnitus. So we see, thousands of patients and fully agree with what you said. It can be a serious problem. And I think that's the approach we need to have, is recognizing this is not just one symptom, but this impacts the global health and brain health in a way that can be really surprising to people.
Again, that's why we have you here on this podcast today, is because we don't take an approach of being kind of more reactive medicine. We tend to be trying to be more proactive in terms of how we age well, and addressing these issues like the first sign of tinnitus or hearing loss and these other things need to be addressed early so that we can, prevent a lot of these other conditions from happening down the road. And so I love kind of what you're doing. We've talked a little bit about the sound therapies, and you've explained how they work. Who do these tend to help the most? Is there, as you're looking at this, what person do you think is going to most benefit from, say, cognitive behavioral therapy, or and I'm trying to remember the exact terminology used, from the earpieces that go in and then the bimodal stimulation?
Typically, I would recommend patients use fundamentals of the sound treatment at the beginning, as well as the cognitive treatment. In my opinion, those are the two fundamentals that patients can implement right away. And then you can get a more professional treatment for both of them. So for the sound treatment side of it, it would be, the devices like this that have specific sounds inside of them that are used for the treatment. Or considering getting hearing aids that can also be used for the tinnitus treatment. The other pillar would be this cognitive treatment layer. And there are certain things you can do on your own. you can study the fundamentals of how to deal with anxiety or stress or how to get better sleep. And then if you needed extra help, then a professional like myself could work with you on those domains, or you could work with a therapist or a psychologist, right? So I say those are the pillars, and that's where most of the benefit today is available for patients. Depending on how those go, a specialist like myself may introduce other approaches, including bimodal stimulation, including other medical referrals to evaluate the jaw, TMJ from a dentist, or the neck, upper neck conditions from a neck specialist. Sometimes medications can cause tinnitus. Sometimes other medical conditions like cancer treatment or certain inner ear conditions can also cause it. So hopefully that's a helpful framework of how people can get started quickly and then escalate depending on how things are going or how quickly they want to progress.
So it really underscores this need to be having our hearing regularly tested.
I would agree.
You're prompting me. I'm going to have to make an appointment for that.
I would agree. Well, let's find a local audiologist who can take care of you. And I wanted to ask you actually, what experience do you have with sort of loud noise? Because for men, for example, it is common to use power tools around the house or go to play loud music. And other individuals might have other loud hobbies, whether that's firearms or they actually have an occupation or a job that works with a lot of loud noise. That loud noise can cause a hearing loss, which can cause tinnitus and put someone at risk of these negative hearing loss impacts. So curious about you, any loud noise exposure in your life?
Not anything overly significant. Probably, maybe an isolated incident here and there. I wasn't one to go to a lot of rock concerts when I was younger. I did go to, some, but I was never like right next to the speaker. Didn't play in a rock band or any of that. So I have no musical talent whatsoever. I have worked in certain areas of construction, but nothing that was, I think, overly loud or, what I'd consider more dangerous sounds, in the work. So I think I've been pretty fortunate that I haven't had any significant exposure to really loud noises that could kind of disrupt my hearing. I'm also one that, I'm not big on kind of wearing earbuds all the time and listening to music. And when I do listen to music, I try not to make it, much too loud.
Got that. Yeah, I think that just as important as getting your hearing tested, one way to prevent hearing loss is to use earplugs or hearing protection around loud noises.
And this kind of leads me to my next question. Tell us a little bit about your tinnitusquiz.com. How does that help people begin their treatment journey?
Yeah, definitely. So tinnitusquiz.com, essentially we created a step-by-step questionnaire that can understand what the individual is going through. So for someone with tinnitus, they might think, I'm not really sure how bad of a problem this is. I could use some resources. I certainly don't want it to get worse. That would be a great reason to head over to the quiz, tinnitusquiz.com. And we set this up for that individual in mind, someone who wants to learn more about what options are available for them in terms of treatments or getting potentially an expert opinion on what's going on in their case. So you go through the quiz, you answer the questions, and then it gives you a result. It tells you the severity of your tinnitus and some options of what you can do to take next steps. For someone that is listening, if you know someone who deals with significant tinnitus and they know, hey, and they've maybe told you, I'm really struggling with this. I would do anything if something could help. I just don't know anything that's out there. That's definitely the right kind of person to also connect to our team at Treble Health. They could also take the tinnitus quiz as well.
And I'm going to ask you a question we ask now of all of our guests. What are you doing personally to age well?
Personally, what I'm focused on is physical health, social, emotional health. So on the physical side of it, here's an interesting point of view that some of your listeners might benefit from. So I started a business 5 years ago, and that over the course of years, there's been different, ebbs and flows of stress. And what I noticed is that I was having some back pain and some muscular spasms that would really set me back. and they seem to be related to stress. So when I was going through a stressful period of my work as an entrepreneur, and then I would try to work out, like go on a run or lift weights, my back would kind of give out, and very normal movements. So I was very alarmed for a while, but recently kind of learned the connection between, if my body and muscles are so tight from stress, that's when I need to be self-aware of it and actually settle my system, not try to force more through it. So that's the most alive thing for me right now is trying to build muscle and work out. I do HIIT classes, high intensity interval classes. I also do some occasional weightlifting, trying to balance that with living a stressful life. And let's be honest, most of us live stressful lives these days. So that's the most pressing immediate thing for me, but also really value community. And I noticed that when I'm not connecting with friends or spending a lot of time with my girlfriend or my family, that I start to get isolated and more anxious. So those are the two things that I'm most working on right now.
That's aging well. So what got you interested in kind of auditory science and tinnitus in particular?
I was interested in the relationship between music, loud noise from music or music festivals, and how that impact people's hearing and their health. That was my original interest, more of a public health angle. My mom is a speech therapist, so and I also have a brother who's an audiologist. So we are, a family tied into the speech and hearing world. And then I specialize in tinnitus treatment. So what got me connected with that was working with patients. I had a residency at the UCSF Medical Center in San Francisco, which is a specialty clinic where I saw people with tinnitus, sound sensitivity, these conditions that most doctors don't know what to do with these patients. But with the right approach and the right system, they got significantly better. And the changes that they make were just so 180 that I realized, wow, this is really reducing people's suffering and it's helping them in a very unique way. And then I had a patient who drove 4 hours from Lake Tahoe to San Francisco to see me for an appointment. And I realized, wow, these patients, this patient, she already went to her local physician. She went to an ENT and audiology specialist, but they didn't know what to do for tinnitus really. So she drove 4 hours to see me. And that was my aha moment of, maybe this appointment could have happened over Zoom and she didn't need to drive so far. A few years later, I started the YouTube channel and the telehealth offering for tinnitus, and that has made a huge impact. We've worked with thousands of patients.
So what's on the horizon in terms of new research or emerging technologies that could change how we manage hearing health, and particularly with aging?
Absolutely. With the hearing component, there has been research over the years for asking the question, can we regrow the cells in the cochlea, the hearing organ? Can we regrow those cells? Because that would cure a lot of people's hearing loss. We haven't been able to do it yet. There are some very smart people who've been trying to do it. That's still ongoing. That would also have an impact for tinnitus because a lot of tinnitus is related to hearing loss as well, right? Separately from that, in terms of tinnitus treatment, there are new therapies or approaches being researched. And right now, in the last few years, bimodal stimulation is perhaps the newest reliable approach in that regard. There's one device available now that's FDA approved. And then there's potentially a new device coming in the next years through the FDA process. So we have our eyes monitoring that. And yeah, if you're listening and you work with a tinnitus specialist, they'll be able to give you more personalized advice on what's best for your unique case.
So we've covered a lot of things in today's episode. Is there anything we missed that you want to make sure that you get out to our listeners?
I want to highlight that if you want to learn more about tinnitus, you can head over to our YouTube channel at Treble Health. And if you are interested in connecting with us, I would recommend this tinnitus quiz, as it can help you, educate you, and get you set on the right path. So my invitation is hopefully you got something from this that can help you in your aging process, your brain, your mind, your heart, your body, whatever you got from this. Hopefully this was worth your time. And thanks, Jeff, for hosting me here. Great to meet you, and hopefully we can connect again soon.
Yeah, I'd love to have you back on. I mean, there's a need to be really underscoring these topics a lot more in the podcast. And so thanks for joining us today. Really just thanks for what you're doing. I know there's not a lot of doctors out there that are doing what you're doing. And so you're reaching a population that really needs some help. And we just appreciate it. And I'm just trying to keep doing what you're doing and keep aging well.
Thanks, Jeff. Glad to be here and great to meet you.